You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Mark Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 1. The Deep Digital Flexor Tendon. Structure, function and clinical relevance.
Origin.
The Deep Digital Flexor Tendon, DDFT, is a vital component of the equine distal limb, primarily responsible for flexing the digit and facilitating weight bearing, locomotion and energy conservation through elastic recoil. Originating from three muscular heads, humeral, ulnar and radial, the DDFT forms a common tendinous structure that continues distally through the limb. The humeral head, arising from the medial epicondyle of the humerus, contributes most to the muscle mass and function. The smaller ulnar and radial heads, originating from the olecranon and radius respectively, support tendon stability and positioning. These heads merge within the antebrachium, forming a cohesive unit encased in a fascial sheath. The DDFT follows a precise anatomical course. It travels distally through the carpal canal alongside the superficial digital flexor tendon, SDFT, where it is prone to compression due to limited space and high mechanical demands. Exiting the canal, it continues along the palmar aspect of the metacarpus, remaining deep to the superficial digital flexor tendon. At the distal third of the metacarpus, the superficial digital flexor tendon forms the manica flexoria as it wraps around the DDFT. Both tendons are encased within the digital flexor tendon sheath, which protects and lubricates them. As the tendon enters the fetlock region, it passes through the sesamoidean canal between the proximal sesamoid bones, stabilised by surrounding ligaments. It then travels over the palmar surfaces of the first and second phalanges, ultimately crossing the navicular bone, separated from it by the navicular bursa, and inserting on the semilunar surface of the distal phalanx, P3. The close relationship between the DDFT, navicular bone and bursa is clinically important, as this area is a frequent site of pathology.
Function.
Functionally, the DDFT controls flexion of the distal interphalangeal coffin joint and influences both the pastern and fetlock joints. It supports the heel during breakover and contributes to the distal limb stability. Given its role in force transfer and shock absorption, injuries to the DDFT, especially near its insertion, are common in performance horses.
The role of the subcarpal check ligament.
The subcarpal check ligament, also known as the accessory ligament of the deep digital flexor tendon, plays a vital biomechanical role in the limb by contributing to the passive support of the fetlock and distal limb joints. Located in the proximal region of the carpus, this ligament originates from the palmar carpal ligament and fuses distally with the deep digital flexor tendon below the carpus. Its anatomical positioning and fibrous composition allow it to function as a stabilizing structure, particularly during weight-bearing and high-performance activities such as galloping, jumping, or abrupt directional changes. The primary role of the subcarpal check ligament is to assist the deep digital flexor tendon in resisting excessive extension, overstretching, of the distal limb joints, especially the fetlock and pastern. When the horse bears weight on its limb, the fetlock joint experiences downward force, causing hyperextension. The deep digital flexor tendon, supported by the check ligament, counters this by maintaining tension and helping to brace the fetlock joint. This passive support system reduces the energy expenditure required by the muscular system, making it a crucial adaptation for both locomotion efficiency and limb durability in the horse. In addition to its supportive function, the subcarpal check ligament helps prevent overstrain and injury. It effectively acts as a tether that limits excessive elongation of the DDFT during rapid limb loading or uneven ground impact. In the absence of this check ligament, or if it is compromised due to injury, the deep digital flexor tendon is more susceptible to strain injuries, which can lead to lameness or chronic degenerative changes. Conditions such as check ligament dysmitis, which involves inflammation or tearing of this structure, are seen in performance horses, particularly those engaged in disciplines requiring repeated flexion and extension of the lower limb under load. From a clinical perspective, the subcarpal check ligament may be surgically transected in a procedure known as a check ligament desmotomy. This is occasionally performed to treat certain conformational issues, such as flexural limb deformities in foals, or as part of therapeutic interventions for contracted tendons. By releasing the tension imposed by the check ligament, the DDFT is allowed to lengthen, which can aid in realigning the limb and improving weight-bearing posture. However, such procedures must be carefully considered, as the long-term biomechanical consequence of removing this stabilising influence can include increased strain on the DDFT and supporting structures.
Clinical assessment.
Clinical assessment of DDFT injury begins with a thorough history, considering onset of lameness, workload, farriery, and previous treatment. Gait analysis helps identify limb loading abnormalities such as head nodding or toe first landing, often seen in DDFT related issues. Conformational flaws like long toe-low heel configurations may predispose horses to tendon strain. Palpation, though limited by the tendon's deep location, may reveal swelling or fibrosis in accessible areas like the metacarpal region. Hoof testers can localise pain near the navicular region, while visual inspection of the hoof can reveal imbalances and deformities contributing to DDFT overload. Flexion tests and wedge placements help assess pain linked to tendon tension.
Veterinary diagnosis.
Diagnostic analgesia is essential for confirming DDFT involvement, especially for lesions within the hoof capsule. A palmar digital nerve block can desensitize the navicular region, including the distal DDFT. The abaxial sesamoid block, while less specific, confirms deeper digital involvement. Coffin joint and navicular bursa blocks refine localization further, with intrasynovial injections helping isolate the source of pain. Diagnostic results must be interpreted carefully, as anesthetic diffusion can blur boundaries between structures. Advanced imaging is vital in confirming DDFT injury. While ultrasound is effective for evaluating tendon injuries in the metacarpal or metatarsal region, it cannot penetrate the hoof capsule. Radiography can reveal secondary bony changes, such as navicular bone remodeling or enthesophytes, at the insertion, though it does not visualize the tendon directly. Magnetic resonance imaging, MRI, provides the most accurate assessment of the DDFT within the hoof, identifying core lesions, dorsal tears, and degenerative changes. Smith et al. 2013, Dyson et al. 2021. Standing low-field MRI offers sufficient resolution for many cases with reduced risk and cost compared to high-field MRI under general anesthesia. Van Vegel et al. 2021. Recent advances have improved diagnostic accuracy. Machine learning models applied to MRI data have enhanced classification of longitudinal DDFT tears, improving clinical decision-making. El Kamari et al. 2022. Three-dimensional segmentation of MRI data has also emerged as a promising method for monitoring DDFT healing, correlating well with clinical outcomes over time. Trollinger Meadows et al. 2021. Computed tomography, CT, especially with contrast, can highlight bony pathology and structural relationships near the DDFT insertion. Tenography and basoscopy further aid in assessing synovial structures and intratendinous pathology. In some cases, tenoscopy allows direct visualization and debridement of damaged tendon tissue.
Farriery treatment.
Farriery plays a pivotal role in both prevention and rehabilitation of DDFT injuries. The tendon is most vulnerable when curving over the navicular bone, particularly during heel loading and breakover. Improper hoof conformation, especially a negative palmar angle, exacerbates tension on the DDFT. Effective farriery management aims to restore proper alignment, reduce strain and support healing. Preventive farriery focuses on maintaining a straight hoof-pastern axis and a moderate positive palmar angle. Reducing toe length facilitates earlier breakover, thereby decreasing mechanical stress. Rolled toes along with supportive shoeing such as bar shoes or pads help protect the tendon from overloading. Wedge heels may be employed to temporarily reduce DDFT tension. Though they require careful monitoring to prevent secondary complications, it is often recommended that a graduated frog support pad is used as opposed to wedge pads without a frog support, as there is the risk that the frog and heel bulbs could prolapse through the centre of the shoeing package. During rehabilitation, farriery must be tailored to lesion location and severity. For lesions in the navicular region, mild heel elevation combined with breakover enhancing shoes is beneficial. Tears within the navicular bursa require more aggressive unloading with wedge shoes, bar shoes and frog support. Horses with negative palmar angles or underrun heels benefit from gradual realignment using supportive trimming and radiographically guided shoeing strategies. For insertional desmopathy of the DDFT, common in high propulsion disciplines, offloading the tendon via mild elevation and breakover enhancement is crucial. In older horses with chronic tendinopathy, comfort-oriented farriery that emphasises support and soft tissue cushioning is prioritised. Mediolateral imbalances should be corrected to reduce torque and abnormal tendon loading. Following surgery or tenoscopy, shoeing should stabilise the tendon, promote healing and adapt over time as the horse returns to work. Close collaboration between veterinarians and farriers is essential. Imaging findings guide trimming and shoeing choices, while regular reassessment ensures that the chosen strategy continues to meet the horse's evolving needs. The management plan should be individualised based on the anatomical location of the lesion, its chronicity, hoof morphology, and the horse's discipline and level of work.
Further veterinary procedures.
Surgical techniques for DDFT repair are evolving. Comparative studies of suture methods show that simple continuous patterns with 2-0 PDS provide better tendon opposition than barbed sutures, though the latter reduce surgical time. Chapman et al. 2017. For cases involving chronic overload or laminitis, techniques like double hemitenotomy have been shown to reduce tendon tension comparably to full tenotomy, offering an alternative that preserves more tendon integrity. De Gasperi et al. 2022.
Conclusion.
In summary, the Deep Digital Flexor Tendon is a structurally complex and functionally critical component of the equine limb. Its deep anatomical location, combined with high mechanical demands and susceptibility to strain and degeneration, makes it a frequent source of lameness, particularly in athletic horses. Thorough clinical evaluation, strategic diagnostic analgesia, and advanced imaging are necessary to accurately diagnose DDFT pathology. Management requires an integrative approach where diagnostic, therapeutic and farriery strategies align to optimise healing, comfort and long-term soundness. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.